Hello ladies out there, welcome back to my channel Bloom with Dr. Mahe. I'm going to discuss with you about vaginal examinations or speculum examinations. What are the indications, what your doctor will do, what is the experience would like, what the doctor is trying to get from doing a vaginal examination on you. So ladies, hang with me and let's discuss this. And I think this is going to be helpful for young ladies, any lady from any age group should be educated on this, and I think they will get benefited because of the information I'm going to discuss in the video. So what is the indication for a vaginal or a speculum examination? The first indication is if you have a vaginal discharge and it is painful when you're having sex, or it is bleeding after you have sex. That means there can be something to do with your cervix. There can be an abnormal growth, which we call a cervical cancer, or a polyp, which can cause bleeding during pregnancy and cause pain during pregnancy, or it could be due to pelvic inflammatory disease, especially if it is associated with a vaginal discharge. So then your doctor will say, okay, we have to do a PV exam or a speculum exam. Why we do a speculum exam is when the doctor wants to take some swabs or samples from your cervix or your vaginal walls from that secretions or the discharge that you're having, to send it to the lab to test what is growing in there, what is the infection you're having. So that's the first indication that a doctor will say we'll have to do a vaginal exam or a speculum exam. The second indication is in your first trimester, if you're pregnant and in your first trimester you're bleeding a lot and you're in a lot of pain, they will do a vaginal exam or a speculum exam to have a look at your cervix, whether it's open or whether they can see any products of your baby stuck in the cervix that causes extreme pain. And they will need to remove those products if you're having a miscarriage or an abortion. So that's the second time that your doctor will say we will have to do a speculum exam or a vaginal exam. And if you are in your second trimester or the second 3 months of your pregnancy, you are having bleed. If you're having bleeding, the doctor should not perform a PV exam without knowing that you have a lower lying placenta. So in that scenario, the doctor should get an ultrasound scan for you to check where your placenta is. Because if you have a placenta which is covering the cervical os or the opening of your uterus to your cervix, then that can cause heavy bleeding and complications due to a vaginal examination. So the doctor should not perform a vaginal exam if you're in the second trimester and you're having heavy bleeding. And the third indication for a speculum exam is when your doctor wants to do a pap smear to check for cervical cancer. And in that instance, they will use a speculum. That's an instrument which I'll put a picture in the video so you can have a look. And that's the other indication, the third indication where your doctor wants to perform a PV or a speculum examination. And the fourth indication is when you're giving birth, especially vaginally. And every hour after you start getting these pains and when they put you on the baby monitor, they will do a PV examination every hour or so to check how much you are dilated. And especially for ladies who had epidural anesthesia for their birth, for their childbirth, where the doctor wants to let you know when you are ready to push. So those are the main indications why a doctor will say we will have to do a PV exam, and the doctor will consent you. He must consent you to see whether you want to go ahead with this examination process. And also he should have a chaperone to be with him and you when the doctor performs the vaginal exam or the speculum exam, and that's for your safety as well as the doctor's safety as well. So those are the main indications and the consenting process for a vaginal examination, and it has to be done in a private area where no one else can get in and break your privacy and confidentiality. So ladies, if you have abdominal pain, it doesn't mean that you will need a PV exam. If you have a PV bleed or vaginal bleed when you're pregnant, it doesn't mean that always you will have to go through a PV exam. So know your main indications why you have to have one. And one more thing, if you want to have a copper coil put in as a contraceptive device, then again your doctor will use a vaginal speculum to put that one in. So ladies, I think this little information clip will help you in your life and to have a healthy life, and that will make a wealthy and a healthy woman. And because these PV exams can cause lots of anxiety in some ladies, I think you should openly talk to your doctor about it. If you're so anxious and if you think this is going to give me lots of pain, the doctor will offer you a lignocaine or a local anesthetic gel to apply in that area, in the vagina, before they start the examination process. That will relieve your pain and ease your anxieties, and you will be able to face this examination process confidently. So ladies, I think this is gonna add up something to your life, and if you have any comments, please put a comment below whether this is helpful or not. And thank you so much for watching. I will catch you in another little video like this.